Hello, I'm Dr. Charlotte Harkness. I'm a psychotherapist and I'm really pleased to be providing some emotional and mental wellbeing advice to the Doris team during these really difficult times. Today I'd like us to take a few moments to think about fear and anxiety, two feelings that are very common at the moment. I'm sure that you've all had some feeling of being afraid, and there's an overwhelming sense of anxiety right now, particularly for people like you that are doing such amazing frontline work. So what's the difference between fear and anxiety, and does it really matter? When we talk about fear, it's usually a more specific feeling in response to a known or a perceived risk, whether that's real or otherwise. Whereas anxiety can feel more like a mood that's there all the time for extended periods of time and perhaps isn't linked to something specific. So let's start with anxiety. At the moment, it's obvious that you'll be having that anxious sense for some of the time, and probably a great deal more than usual. Things that help this feeling are knowing that anxiety is normal. Anxiety is one way of processing a situation, of trying to make sense of it, find some meaning in it, understand something. So we need to accept that we are in times that are really difficult and they're to make sense of, and therefore we will be anxious. We should expect that. Being present, trying to focus on being present helps with anxiety. Focusing on right now. What are you doing right now? If you have that anxious feeling while you're at work, try practice focusing on your breathing. Try hard to focus on the work that you're doing. Breathe in slowly and out slowly. Give yourself a break from the feeling by saying, what I can do now is complete this task and then give myself a break. So just breaking it down into really small moments of right now. Anxiety is a very physical experience, and even in the midst of really anxious feelings that feel really awful, we have to understand that they will pass. Our bodies cannot maintain that sense of anxiety, those physical sensations, for that long. So again, focusing on breathing slowly and distracting yourself, particularly if you can move around and do something physical, really helps. Some people find it helpful to think of the words breathing anxiety out of me as they exhale. So breathing in really slowly, and as they exhale, saying to themselves, I'm breathing anxiety out of me. Fear is often more specific, as I said, more tangible. So in some ways it can be easier to address than anxiety. What are you afraid of? As I mentioned last week, talking about it, naming it, can in itself be helpful. Whatever it is, I'm sure that the fears that you have are shared between each other. So in listening to each other and being kind to each other, you're being kind to yourself too, and listening to yourself. You're doing an amazing job in the most challenging of times. So be kind to yourself. Take a moment to pause and think about how you are rising to a frightening challenge. Only a robot would not be afraid right now. What is important is that we think about coping mechanisms. What calms you down when you feel anxious or afraid? What helps? And be honest with yourself. Are your coping mechanisms healthy? Is there anything you could tweak a bit or do differently? What kind of coping mechanisms do your colleagues and friends use that you might adopt too? And please, please, always talk when you feel scared or frightened, when you feel anxious. There is absolutely nothing to be ashamed of, and no point at all in hiding these sorts of feelings. These feelings are absolutely to be expected. They are a human response to very out of the ordinary experiences. So be kind to yourself. Be as kind as you possibly can.